Hey there, welcome back to the channel. Today we're diving into a topic that's a little, well, personal, but super important. It's something you might not always talk about much, but you definitely should be paying attention to. Your poop. Yeah, you heard me right. Your stool can tell you a lot about what's going on inside your body. So let's flesh out the facts and learn about the things your stool says about your health. Let's kick things off with something you can easily notice: color changes. The color of your stool is one of the biggest indicators of what's happening inside your digestive system. A healthy stool is usually a nice medium brown, thanks to bile, a digestive fluid produced by your liver that helps break down fats. But what if your stool isn't brown? Here are some color changes you definitely want to watch out for. Let's start with green poop. If your stool is green, don't panic just yet. It might just mean you're eating a lot of leafy greens, such as spinach or kale, or even from food coloring. But if green stool sticks around for a while, it might mean that food is moving through your digestive system too quickly, and bile hasn't had a chance to turn brown. This can happen if you're dealing with diarrhea or an infection. But if your stool is pale, clay-colored, or even white, that's something to take more seriously. This can indicate a lack of bile, possibly caused by a problem with your liver, gallbladder, or pancreas. You definitely want to reach out to a healthcare professional if you notice this. If your stool looks black or tarry, it could be a sign of bleeding in the upper digestive tract, like your esophagus, stomach, or small intestine. The blood gets digested as it travels down, which is why it turns black. However, if you've been taking iron supplements or certain medications such as bismuth subsalicylate, which is found in Pepto-Bismol, they can also darken your stool. On the flip side, if your stool is bright red, that might indicate bleeding from lower down in the digestive tract, like the rectum or colon. While it could be something simple like hemorrhoids or a small tear, also known as an anal fissure, it could also be a sign of something more serious, like polyps or even colorectal cancer. Beets, other red vegetables, cranberries, and red food dyes also can turn the stool color red. And let's not forget yellow or greasy-looking stool. This can be a sign of excess fat in your stool, possibly due to malabsorption issues like celiac disease or a pancreas problem. Basically, if your body isn't digesting fats properly, they come out in your stool, giving it that yellowish greasy appearance. So remember, if you notice something unusual in the color department, it's worth keeping an eye on, especially if it persists. It's always better to play it safe and see a healthcare professional. Number 2. Shape and consistency. Believe it or not, the shape and texture of your stool can tell you a lot about how well or how poorly your digestive system is working. Doctors and health experts often use something called the Bristol stool chart to classify stool types. This handy chart breaks stool down into 7 categories, ranging from hard lumps to watery diarrhea. Ideally, you want your stool to be a type 3 or type 4. That's the gold standard: smooth, soft, and sausage-shaped. Let's walk through the 7 types on the Bristol stool chart, so you can figure out where your stool falls. Type 1, separate hard lumps, almost like little pebbles. Type 2, lumpy and sausage-like. Types 1 and 2 describe stools that are hard to pass and are often a sign of constipation. Several factors can contribute to this, including a diet low in fiber, not drinking enough fluids, or gastrointestinal issues like irritable bowel syndrome. Some medications can also cause constipation as a side effect. Stools that are hard to pass can cause you to strain when trying to have a bowel movement and lead to diverticulosis and hemorrhoids. Next is type 3, a sausage shape with cracks on the surface. This is a good sign. It's soft enough to pass easily, but it's still holding its shape. You're in the healthy range here. Type 4, smooth and soft like a snake. This is the ideal poop. If you're producing type 4 stools, your gut is likely functioning just the way it should. Type 5, soft blobs with clear-cut edges. This can indicate that you might be on the verge of diarrhea or perhaps you're not getting enough fiber. Type 6, mushy with ragged edges. This indicates mild to moderate diarrhea, and it's often a sign that things are moving through your digestive system too quickly, possibly because of stress, an infection, or certain foods. Type 7, entirely liquid, watery, no solid pieces. This indicates severe diarrhea, and it's often caused by viral or bacterial infections like norovirus or E. coli, or parasitic infections such as Giardia. Certain medical conditions like celiac disease, Crohn's disease, or ulcerative colitis can also result in type 7 stools. Next at number 3, floating poop. If your poop floats, it could mean there's excess gas or fat in your stool. Gas can build up when you're consuming a lot of fibrous foods, like beans or broccoli, or if you're gulping down air while eating or drinking. While a floating stool from gas isn't usually a big deal, consistent floating stools could be a sign that your body isn't absorbing fat properly. This condition is called steatorrhea, and it often happens with digestive disorders like celiac disease or chronic pancreatitis, which affect how your body breaks down and absorbs nutrients. If you start noticing it often, especially paired with other symptoms, like oily stools, foul-smelling poop, or diarrhea, it might be worth having a conversation with your doctor. Number 4, frequency. When it comes to how often you should be going, there isn't one perfect number that fits everyone. In fact, normal can vary quite a bit from person to person. On average, experts say that going anywhere from 3 times a day to 3 times a week is considered within the healthy range. Yep, we all have our own rhythm. Some people have what we call a fast-moving digestive system and tend to go more frequently, maybe even after every meal. Others have a slower digestive system and might only go every other day. What's important is that you pay attention to changes from your regular routine. Now, you might be wondering how long it should normally take to poop. Well, it's often joked that if someone spends too much time in the bathroom, they must be pooping. But in reality, a healthy bowel movement should be easy to pass and take only a minute or so. That said, some people do spend a bit more time on the toilet, so as a general rule, a poop should take no more than 10 to 15 minutes. Number 5, smell. Okay, poop smells. That's no surprise. But there's a range of odors that can tell you what's going on inside your gut. The smell of your stool is largely influenced by the bacteria in your digestive system and the types of food you eat. If you've recently eaten foods high in sulfur, like red meat, eggs, or broccoli, your stool might have a stronger, unpleasant odor. However, if your stool has a strong, persistent rotten egg or sulfur-like smell, it might indicate malabsorption issues like lactose intolerance or celiac disease, where certain foods aren't being broken down properly by your digestive system. Bad-smelling poop can also be a sign of infections like C. diff or parasitic infections like giardiasis, which disrupt your gut's normal function and lead to extra gas production. Number 6, mucus in stool. Seeing mucus in your stool can be a little alarming, but it's important to know that a small amount of mucus is completely normal. Your intestines naturally produce small amounts of mucus to help keep everything moving smoothly through your digestive system. However, if you start noticing a lot of mucus or it's accompanied by other symptoms like diarrhea, abdominal pain, or blood, it could be a sign of inflammation or infection. Conditions like irritable bowel syndrome or inflammatory bowel disease, such as ulcerative colitis or Crohn's disease, often cause excess mucus due to irritation and inflammation of the digestive tract. Number 7, undigested food in stool. Seeing undigested food in your stool, especially things like corn, seeds, or leafy greens, is more common than you might think. Certain foods, particularly those high in fiber, have tough outer shells that are resistant to digestion, so it's normal to spot small bits of them in your poop. At times, undigested food is a sign of poor chewing and fast eating, so make sure that you chew your food well. Undigested food in stool is generally not a concern unless it's accompanied by persistent diarrhea, weight loss, or other changes in your bowel habits. If you notice these symptoms, it's important to consult your doctor. Number 8, pencil-thin stools. Noticing pencil-thin stools can be concerning as it may indicate narrowing in the colon. While it could be caused by something simple like constipation or muscle spasms in the colon, which temporarily constrict the passage, persistent thin stools can be a sign of a more serious issue like a colon blockage. This could result from inflammation, scar tissue, or even a tumor pressing on the intestines, reducing the space for stool to pass through. Conditions like Crohn's disease, diverticulitis, or colon cancer can all lead to chronic narrowing. Well, that wraps up our deep dive into the world of poop. Who knew your stool could tell you so much about your health? It's not the most glamorous topic, but it's definitely an important one. If you enjoyed this video or learned something new today, don't forget to give it a thumbs up and subscribe for more helpful health tips. Thanks for hanging out with me today. And until next time, stay curious, stay healthy, and remember, your body is always sending you signals. All you have to do is listen. Or, in this case, look. See you in the next video.